Yeah, no kidding.
It is, okay, who's got somebody in the background?
I'm going to mute
Woo.
us.
Okay, go ahead. Hmm. Everybody stay hydrated. Water's the elixir of life. Hmm. Ah. It's exactly 8 o'clock, but we're waiting till about 8:15 because not 8:15. We're waiting to 8:04 because there's a lot more people that are going to be coming on, I think. I know Beth Matlock is coming on. I don't see her yet. She's so cute. Hey, Deb's on there. Deb McTammany's on there. Deb is learning about her new life. Deb McTammany, you're right next door to Deb Schindel on the four squares here. You guys are side by side. I see you buddying up. I know
Oh, there
that.
she is. Hi, Deb.
Hi, how you doing?
Today Brenda got to meet Holly and Holly's husband and Nora's dad because she was in the office. This is our little world that's expanding in really, really big, good ways. But you guys know that.
Funniest, Beth, is I did not know the background story as to why Nora ended up
Oh,
arriving after everybody. So I was telling Mark today, and I did everything but like laugh because it's so typical of these kids, right? That's what we were talking about.
I know if they grow up and they feel like they're privileged because they had a clean house, two loving parents, they didn't have to fight for food on the street. Somehow they feel as though they then have to go through the process of
Rebelling
being
against
being a
everything.
poor white child.
Mm.
Hey Ruth Merrill, I love my
There's
quilts
Ruth.
by the
Hi,
way.
Ruthie.
Ruthie's an amazing quilter. She makes the most gorgeous quilts, and I wrap myself up in mine, so I love it. Thank you.
Oh, you're welcome. Happy you like it.
I have more than one. Truth be told, I bought one of them at the fashion show because I didn't have a place to display it out. There was only a picture. It might have been kind of a subliminal thing that I really wanted it myself anyway, so I ended up just donating for it because I really liked it. So if you come to my house and hang out, you'll be underneath one of Ruth's really pretty quilts. All right, I think we are at 8:02. Hi, Sue Stever. I saw you this morning. I started my day with you on Tumor Board. I'm going to switch this to speaker view. There you go. Hey, Beth.
Hello.
I'm going to ask everybody to
Hi,
mute.
Beth.
I'm going to ask everybody
Hello.
to mute when if you're not talking until you ask questions. Kind of excited for tonight. I wasn't expecting to do this. I thought I was going to have this whole week off, and my nurse practitioner had a little incident, so I'm working for her. And Dr. Don Francesco was supposed to do this evening, but her husband, of course, had something to do, so she is the kids. So Christina said, "Okay, you got to fill in." So I said, "Okay, fine. Here we go." So tonight's surgeon survivorship experience, I was working on slides, like trying to bust through them fast, and I was like, you know what, we don't need slides. So myself, Beth DuPree, Stacy Kreischer, who's right in the middle that says HCF host, because that's what we do. We pretend not to be who we are. And then in my computer screen, right above her is Ann Shivas, who is like freaking awesome. And all the rest of you are absolutely beautiful, amazing souls. So thanks for coming on tonight. And the topic tonight is healing frequencies and the vagus nerve. So I'm going to give you a little background first. Many of you participated in or know about the Mind Vibe trial, the trial for the vagus nerve stim. Thank you, Dr. Kreischer, for being our principal investigator for this. And to remind me, I have to show you the poster because I'm turning it in. Stacy's the PI, but I've been the poster queen, getting this ready for the meeting because she's so busy taking care of patients that I got volunteered to do it. So, but I did it, and it looks really pretty, and I think you're going to like it. So many of you know about our Mind Vibe technology. It's a non-invasive way to stimulate the vagus nerve. It is absolutely a wellness device. And everything we're talking about tonight are wellness devices, which means that they are not meant to diagnose, treat, cure, or prevent any disease. What they are meant to do is help your body get back into a state of homeostasis, which in homeostasis, that's where our bodies are able to learn to heal. And I've known for 2 to 3 years the importance of the vagus nerve. I knew that this technology worked. And when Stacy, Anna, and I kind of conspired, we said the best way for us to be able to prove to the world and get this technology out to other women who've gone, and men, whoever, cancer survivors, is to do a clinical trial. So we're publishing the first half of the trial, which we had such highly statistically significant data. We improved the ability to sleep. We decreased insomnia. We improved overall well-being. We decreased stress with the NCCN and the NCCN guidelines, and the NCCN distress thermometer. So we basically hit every metric and then some. And we also showed a marked improvement in heart rate variability. That's the little thing if you're in the study when you had the little wrist clips on. And because of that, we are presenting, the royal we, Stacy, Ann, and I are going to be presenting our poster at the American Society of Breast Surgeons. I'm going to be talking about it at Survivors Day. And my goal is by the end of this summer to get this into our cancer center and make the hospital pony up, because we know how well it works. And if you want to know and take the deep dive on the vagus nerve, go to my YouTube channel and watch the lecture that I did on the vagus nerve. I just did it at the Naturopathic Oncology Conference, but it goes into more than just what the Mind Vibe studied. It goes into boosting immunity. It goes into longevity and increasing your T killer cells and your T helper cells. And it really is a rock star, massively transformative technology. And the reason why the trial's done now is because we've reached statistical significance, and we don't want to put people through a clinical trial. We just want to be able to provide it. So for everyone that was on, everybody that's been on the trial, they've been able to come back and call, I'm calling it a reboot, or get another Mind Vibe session. And many of you, I am so thankful that you took advantage of it, because I get the little list because I'm the one that turns it in for her to get paid. But Ashley is amazing, and she's going to still be able to offer it. For anybody who didn't qualify for the trial, we are now offering 5 sessions free of charge from the foundation. And if you go online and you look, the other place, if you go to a center that's offering it, for a lot of them, it's close to $1,200 for 5 sessions. So you get your first 5 sessions free of charge. And then if you want to come back for additional sessions, it's going to be $50 a session, because we've got to be able to pay for our technologist and all the pads, but we're not making any money on it. It just is what it is. So, and this goes for everybody in Sedona and in Pennsylvania, where we have it both places. And ideally, I think, I don't know, Stacy and I haven't even talked about this, but ideally, I think that I would love to be able to offer this to every patient after, when they're diagnosed, because there's that time between diagnosis and surgery, where I really think if we can help calm the nervous system, we can make a difference. So that is that for the Mind Vibe. Now, if any of you have loved ones that have issues with sleep or feeling anxious or whatever, Mind Vibe is available. There's a couple different places to get it. If they want to do it through us, because our charter is to support breast cancer survivors, they're welcome to make a donation to the foundation for the $250 for 5 sessions, which is still about 1/5 of what somebody would pay if you go to one of the Mind Vibe places. But we're doing that because anybody that donates money to get it, it's going to go back to pay for another breast cancer survivor to go through it. So that's that. Any questions on the Mind Vibe? Stacy, you want to say anything about the trial, because you were the kingpin?
Yeah, well, I mean, it was actually pretty impressive. We saw significant changes in it, and we had hard measures. I mean, some of the measures were just subjective, like patients had to fill out different questionnaires, like about sleep and stress and things like that. And then we had a hard measurement, which is something called heart rate variability. So a lot of you guys that have like the smart watches or Oura rings and things like that, you can measure that. I think those devices measure that kind of continuously. I'm not sure about their accuracy, but we could definitely see a significant improvement in heart rate variability with with the device, which is kind of a hard measure of what general well-being. So, seeing that significant improvement is kind of like a hard measure that we were able to obtain. And I think we got a lot of positive feedback on it. Sleep improved, stress levels improved. It was really
anybody on here that participated in the trial that wants to say anything? Go ahead, Kim, because I see you like shaking your head. Do you want to talk?
It really helped me with sleep. That was it was the best thing. I didn't notice it that first week when I was doing it every day for 5 days, but then the following week and for 2 weeks I started doing really great. And then I did go back for a reboot, and it helps.
And you can continue to, and this is the thing, the whole thing with the reboot is not everybody, we got statistically significant results out to 12 weeks, but life happens. And when life happens and your nervous system gets twinged, it's really nice to be able to go back and go, hey, let me just reset. Ruth, did you do it? You're still muted. Oh, wait, let me see if I can unmute you.
There. Okay.
There you go.
Yes, the first 5 sessions were amazing, and I noticed it right away. And so I'm going back to Christina every 2 weeks. I've got an appointment set up, and I love it. And I'm going to send my husband too, because he can do it too.
It's pretty amazing, and I hook myself up not infrequently. Right now, my machine is, I don't know where my machine is. I got a couple people that I love, getting them off their Western medical pill for the ill kind of things that their doctors did, meaning well, but anyway. So that's up with Mind Vibe. It's never going to leave the foundation. To me, it is one of the most valuable things that we've ever done through the foundation, because not only do we help you feel better well-being wise, but when we bring you into parasympathetic rest and digest, it literally has anti-tumoral, anti-cancer, positive immune boosting. It's across the board. It's really good for mental health and well-being. And I think, the study that I would love to do is to follow patients long-term and, for like 10 years and look at risk of recurrence, because I, in my heart of hearts, believe that stimulation of the vagus nerve is going to do that. So 2 other things related to the vagus nerve before we move on. Number 1, Dr. Scarlett's been studying forest bathing, and I am literally smacking him upside the head with a 2x4 that I want him to put together a forest bathing experience here in Bucks County. We've got beautiful places to do it. So he's not on this call tonight because I don't know where he is, but he's getting voluntold by me because he went and studied it. He loves it. And forest bathing is basically a way of getting grounding in earth. Stacy knows. The other day she's messaging me. She's like, oh my God, this whole earthing thing. Like, she ran outside and took her shoes off and rubbed her feet in the grass. Hopefully no dog dirt, but really got grounded in the dirt. And that's one of the things with forest bathing, because you're connecting to the energy of Mother Earth, of Pachamama. You're connecting to the Schumann frequency, which is that resonance of connection to the earth. And the second thing is, I do breath work, which I find incredibly helpful. If you watch my YouTube, if you watch my lecture on the vagus nerve on YouTube, you'll see the gentleman that I work with. His name is Ishan Shivanand. He does a breathwork program. It's pretty intense, but it really works. And he was able to show statistically significant long-term results after like 8 weeks of breathwork using his program. So I highly recommend it. So now, any questions on Mind Vibe before we move on?
Oh, besides breath work, Beth, what about other methods of vagal stimulation?
Oh, what else, Stacy Kreischer? You can put cold water on your face. You guys ever hear the dive reflex when someone gets in cold water and they survive? So you can splash cold water in your face. You can do cold plunging.
Meditation,
yoga, where you are literally, where you take the focus out of your brain and bring it to bring it like to your heart center.
Can I add in one?
Please.
If everyone just plugs one side of their nose and
you Nadi showed him. Isn't that not?
Yeah, and then you breathe in for 1 minute on one side, sorry, and then you do the other side in 1 minute, it'll gradually calm down the nervous system. So, if you're driving, it's a good time to do it when you're driving, things like that.
And it's called something. We do it in yoga.
Nadi showed, isn't it
I
Nadi
don't know.
showed him? What's
Yeah.
it called,
Nadi
Deb?
Shodhana. Nadi Shodhana.
Yeah,
Okay.
thank you. Nadi
Yeah.
Shodhana.
Okay.
Okay, so now we're moving into phase 2. This is all kind of new to you guys. I'm gonna talk to you about a wellness technology called ion cyclotron resonance. We call it ICR. ICR is a wellness technology that utilizes low level. Oh wait, who is there? I'm going to mute. I think it's my sister. The ICR technology is a technology that, for any of you who have read my second book, at the end of the last chapter, there was a place where I had an experience with the Archangel Raphael and these sentient beings who said, there's going to be a technology that's going to come along that can not only help the body relax to allow it to heal, but it could also potentially restore and regenerate. So we know that there's parts of our body that can regenerate, like our liver and different areas, but I don't even think we've begun to tap into the true healing potential of our body. So I've had my eyes open, and in October of this year, many of you know that I also work with the non-narcotic pain patch company. So they had asked me if I would go speak at a conference in Tucson. And it was like the 1 week that I was going home to hang with my husband because I was watching my granddaughter at the beginning of the year. Anyway, I said yes to the speaking opportunity, even though I really didn't want to go because I wanted to go back to my house and chill out. And on the same stage with me on a talk about mental health and wellness, I met Ann Shivas, who's on the top of my row. I'm not sure where she is on yours, but Ann is she's a clinician who's trained in, she's a Canadian osteopath, which is a little different than a US osteopath, because Ann really actually remembers and knows how to utilize the osteopathic manipulative technique. She understands the physiology of the body. She is a master on embryology. She knows body types. She knows which body types are susceptible to certain things. She's like, I call her, she's the body shaman, because I've been working with her now for a couple weeks, and it's absolutely like magic to watch her work and watch her be able to help people who've been coming into our clinic to be able to come balanced. So one of the things that we've recognized in survivorship is that fatigue, poor sleep, and feeling anxious, having the fear of recurrence, having any kind of pain, whether it's from implants or from radiation therapy, or the way you carry your body because you may have a tight muscle on one side or the other, some digestive issues, like all of these things are chronic stress response after treatment. And so we want to be able to help all of you get out of survival mode and move into regulation and safety, where your body feels safe again, where it can actually heal. And so one of the things that really spoke to me about ICR is based on the idea that we're all living systems. You guys all know that we're all these beautiful amalgamations of cells and water, and we make up skin and organs and everything else, but we are living systems that are completely electrical, not just biochemical. And that's the part where I think Western medicine has missed the boat, because so much of Western medicine is based on biochemical compounds to treat symptoms in our body. So we've become that system where if there's a symptom or an ill, people want to try to medicate it with a pill. So if we're thinking, and we're thinking survivor friendly, we've got to be able to reestablish the communication, rhythm, and signaling between the extracellular matrix, which is all the fluid we're 60% water. We've got to improve the communication between the cells, the extracellular fluid, our tendons, our muscles, and get those signals to come back into alignment. And so what ICR does is it supports the body's, supports the body's regulatory intelligence. It's a support. It's an emerging technology. This is not a alternative treatment to treat your cancer. This is not an alternative treatment to surgery or radiation or chemotherapy, but our bodies are bioelectric and our cells communicate through this bioelectric signals. So ICR is basically using these low-level frequencies in specific relationships with whether it's your bone or your muscle or your tendons or your brain or your bladder. And what we're trying to do with ICR is to get that communication better between the extracellular matrix and your body and create resonance. So, Anne, how did I do? You're on mute, sister.
Absolutely fantastic. It's perfect. Perfect.
So Anne has been using this. She's going to tell you her story, but we met on stage. We were on stage for 45 minutes. I might have talked to her for 4 minutes in Ohio. And by the time we had our second conversation, I was dragging her and Dr. Garoli here in January to do our level 1 ICR training. I purchased a mat. I said, my patients need this. We need this. Healthcare needs this, because this is about bringing the body back into a state of health and well-being. So Anne, I'm going to let you go from there. Tell your story, and then we'll talk about how we're integrating this into our practice.
Yeah, sure. I think a little bit of history, because a lot of people have asked about it and where it's been used before in the world, and how come it wasn't in the USA. And look, I'm not American. I'm from Canada. Some of you know that. I've seen some of you in the clinic, so it's nice to see you on here. It is a registered medical device in Canada and actually in Italy. And so we're using it to that capability. In the US, we're using it as a well-being device until we get it FDA approved. So I think that's really, we have to say that, because when you come in, it is a well-being session. But some of you probably on this call have said, oh my gosh, my pain goes away and so on. And so, what we're trying to do is, and if you've come in, you've probably seen this, I have this little book of cards, these magic cards, and they kind of look like a hotel key card. And these hotel key cards are loaded with a message. Just like you would tap the hotel key room door and it would let you in the door. It's the same kind of thing. We have the hotel key card and we pop it into the mat. And what happens is a resonance comes out of the mat. You lay on this mat. And we also have what are called targeters. So you might have had a pad or a belt on you where we're targeting a certain area of the body that we want to speak to. And that's really what it does. It speaks to your body, and it can change how your cells, in a way, are speaking to each other. So let's talk about something that I think we all know about, inflammation. And then I'll talk to you a little bit about how I met Beth and how it came to be in the clinic. But if you have a high inflammatory response, you feel swollen, you might feel pain, these kind of things, we can speak to that inflammation and we can lower the inflammation. And therefore, your pain would be lowered. So we're not saying it's going to substitute out every painkiller that you might have or every surgery you might need to go through, but we can definitely support you on that journey. So that's the part one. But just to backtrack, when I met Beth, I need to really add in that she gave me one of her books in Tucson. And I went home and read it. And at the time, this was back in October, I was just ticking along in my clinic in Canada. And I'm on Vancouver Island for anybody who knows it. And it's poorly resourced on Vancouver Island. So I have a few of these mats because I'm able to treat so many different modalities there where people can't really get the type of care that they need. Some people are waiting 2 years for a surgery that they really need. And that's the reality of the healthcare system in Canada at the moment. And so I started, ticking along with this, and we have a couple practitioners using it. And as I was reading Beth's book, I saw these parallels between our journey so far. Mindfully, her journey is absolutely amazing. And I'm in my 40s, so I haven't even quite done half the things that Beth has. But I thought, gosh, I really need to connect with her. And I just wanted to talk because I thought, okay, maybe there's someone else out there doing kind of the same thing as me. I kind of get called the weird one. So we got on it. We got on the chat, and it went from there. And then my partner, our business partner Alberto, in this, and he's also my life partner, beautiful man, brilliant. He's the one that actually puts the message on these cards that some of you have experienced, and we're able to really help you change yourself into homeostasis. So we're changing the signal of how your body's really speaking to itself, if that makes sense. So let's fast forward a bit. Like Beth said, she she said, look, I'm going to get these and we're going to come down. And gosh, I think we maybe had about 12 people down in Philadelphia where there was that huge snowstorm in January. And we started taking practitioners on the journey. And some questions we've had on the way is, can I have one of these at my house? And, how do I get one of these? I need to explain that we've actually tried that system in Canada and it's completely failed because there's layers in your body, right? So there might be the inflammation side, but where's the inflammation coming from, right? And then how do we support maybe bone health even below that because we know bone health and inflammation are married to each other. And we can do this all through, our well-being system. So it was really interesting because we had all these practitioners come and they're interested in using this model. And I think, right now where we're at, and if you've had an experience on here and you can speak into it, I would love that. But we're just scratching the surface in this in the USA. I want you to know that. And where we're at. And thank you, Beth and Stacy, and for all the people on here that I've met. Thank you for being so open. This little Canadian walks into your clinic and says, well, I'm going to treat you with this thing. And so I really appreciate everyone's openness to coming in and giving it a try. And then also, the people I've met so far, you've been really committed to the journey. And I must explain that some people come in and they have an instant result almost, but we have to understand that everyone's a little bit different on their health journey. And so sometimes, this might be a 10 session program. And that's really good to just say out front, in regards to how chronic it is in your body and how long you've had it. And if there's no lifestyle changes and these kind of things, then we might look at 10 treatments. Whereas, some people have graduated out of their pain, for example, in 3 treatments time. So everyone's a little bit different on the journey that way, and everyone's body's different too. And I think that's what the glorious part is we treat the person walking through the door. It's not a one-stop shop, and admittedly, sometimes I don't get it right the first time because there could be something that I'm missing. So we just do a deeper dive and a deeper dive, and it's a little bit of a journey of discovery. So we have protocols that we're following in there on the well-being protocols on that side, which is absolutely wonderful. And a lot of you are experiencing those. And I imagine Beth is going to open up for you guys to speak into that space. But at the same time, I'm also happy to answer any questions you may have because I have worked with it as a medical device in Canada. I've been over in Italy. They're using it in hospitals in Italy. It's incredible. So they're having some really amazing results. I probably told you guys some stories because I'm sitting with half of you and talking your ear off during your treatment where maybe I should let you rest. So, and then, I'm also happy for feedback as well, because if I have met some of you, naturally, I'm new in the US. I want to make this really good for everybody. I would love for everyone in the US to actually experience this. So anything that you want to share with me, I'm really happy to listen to improve as well. So I hope I covered everything. And Beth, if there's something you want me to add in, I'm happy to add something in too.
No, pretty much when what really kind of piqued my curiosity, number one was I was told a couple years ago that I was going to get introduced to a frequency technology, and it wasn't the transcranial. The vagus didn't exist at that time, but the vagus is awesome, and it's a fabulous technology for our niche piece of stimulating the vagus nerve. Even though ICR can stimulate the vagus nerve, our technology and the frequencies that Dr. Katznelson has put together are rock star. And so we're not competing. This is not we're not trying to replace anything. But what happened was when Anne introduced me to this, and I met Dr. Garoli, and I started reading the peer-reviewed papers for different case reports and things that they were seeing in Italy. I was like, all right, this is, to me, has the potential to be an incredibly disruptive technology, meaning allowing our patients to receive a higher level of healing, allowing their body's own innate healing systems to work by, decreasing the inflammation, by increasing the frequency and the extracellular fluid, giving the body the ability to get the calcium and the magnesium and the vitamin D into the places it needs to be. And so it really kind of blew my mind. And I thought this technology is too good to pass on. And luckily I have a very wonderful foundation board that when I brought it to them and said, listen, I want to buy one of these mats. I've never been on it. I haven't used it, but I've read the science. And I want us to support this course. Everybody voted yes, we got it. And I will tell you that just it's the small things that are big things. But what we're able to do from a wellness perspective, I think that when we kind of get rocking and rolling, and our plan is actually to do clinical trials. And there are many potential clinical trials. There's a potential for us to do trials on reversing osteopenia and osteoporosis, because we know that the medicines that we ask you to take oftentimes for 5 years lead to bone thinning. And if we can prove that we can reverse it with these ICR sessions, when I put someone on an aromatase inhibitor, I'm going to say, here's your prescription to come by and get your 10 treatments of IC. So we need to prove it though. Like, I need the scientific data, because we live in that world where we've got to prove what we want to do. But I think it's going to be a great thing to do. We're seeing really great results with some patients who've got chronic inflammation and pain, being able to help decrease that. So we're putting our minds together. We're actually having a mind melding summit for 6 days next week. Dr. Garoli and myself, Dr. Kreischer, a very good friend of mine, Laura, she's an OBGYN. We're going to mind meld. And yeah, we're going to Lake Como in Italy. So don't be jealous. If you want to get on the plane, we leave Friday night at 7:00. But we've been invited to go to Trento and meet the gentleman that invented this technology, meet his daughter that's running the company, because we're pretty psyched about what we can do. I think we're just scratching the surface, so to speak. But Anne has been busting her hump for the past 2-3 weeks in the clinic. And she actually changed her flight. She's supposed to leave tomorrow morning, but she changed her flight so that we could treat more people this week. And the reason why Stacy and I decided to go to Italy, it started out with, hey, if we can save, $1,500 to $1,800 per mat in customs, if we can go to Italy for under $1,000, we're going to save money. That would literally, Stacy was laying on the mat, and I was proposing this to her. Like, I was explaining in my mind how we're going to save $3,000 if we spend $1,400 to fly to Italy to pick them up. So we got really cheap airfare for $700 a piece. And then we told our husbands we were going over my 65th birthday, which was kind of funny. But now, as things have progressed, like, this was divine intervention. We were meant to be there at this time to, be able to meet the Valeria, the inventor. And I want to hear his story. And this is, we're at the beginning of a really special journey, ladies. And the reason why this was so perfect that Stacy Don Francesco couldn't do this tonight is, what I want to let everybody know is we're doing the same thing with ICR. So typically, if we were charging, because we weren't going to charge a ton of money, but if you were coming in and paying for this, you'd pay $150 for the assessment and the first session, and then $90 a session. But what we're doing for all of our survivors is you get that assessment is covered by the foundation and your first 5 treatments. And then after that, we're going to do the same thing we're going to charge $50 a session for the ICR, because we have to pay technologists. We've got to pay Anne, because she's helping us learn how to use all of our credit cards, which it looks like we're going out to lunch when we pop the card in the thing. And if you have family members, because a lot of people have family members who need, they can make a donation to the foundation for the $150 and then the $90 a session. I want to make it open so people can actually get the option of trying this, because we're the only ones that have it. It's not like I can say to your family member, hey, listen, we're only doing this for cancer survivors. Go to Italy because that's where they have the mats. I literally bought, the HCF bought the first mat in the country. So we're gonna have 3 mats rocking and rolling, and I'd love for y'all to try it. And I know Sue Stever, the same deal goes for our nurses and employees that work in cancer center, that we're treating you like cancer patients. We don't want you to be cancer patients, which is why we're going to offer this to you, because we're caring for our caregivers, because we caregivers don't really take enough time to care for ourselves. So so that's the answer for you, Sue Stever, who was going to raise her hand and ask. So
And can
anyway,
I add in that's something for you,
yeah.
for well, you know, in Canada and in Italy, we're helping children. A lot of children are going through school at the moment, and they're getting these crazy diagnoses that I've never even heard about in my life. And maybe you as a child went through, and maybe you were, you know, put in the corner for how you were behaving or what have you. And we want to work with these kids. We want to work with families to make sure that they're thriving. And some of you might think, oh, you know, it's only maybe meant for pain, or it's only maybe meant for inflammation. If there's a problem with somebody, send them our way. Because what we're doing is we're collecting data, and we're able to, for me, it's wonderful because if they come on in and I can collect data, it's going to give us some stronger protocols, because every place on the planet is a little bit different. So, you know, if you go to Sedona, you see red and it's full of iron. The Earth's actually full of iron. And let's not forget that we're connected to planet Earth, right? And then, you know, we come over to this side of the US, and it's actually quite low in zinc. I actually sat beside a farmer on the airplane and I learned that. So he gave me all the data on that. Fantastic. And yeah, it's low in zinc. And so these are things that I'm collecting and discovering, because then we know, especially even when Stacy follows through and has all of her functional med, these are things that we're going to be talking about, because maybe zinc is something we give you, or magnesium is something we give you, because when we plug in a card, we can speak to the cell, okay, and we can add into the cell, or we can take away from the cell. And there's all these goodies going in and all these goodies coming out. That's really how it works. And when the cell doesn't have its feeding anymore, or inflammation anymore, you can look at a white blood cell coming around like Pac-Man and eating the cells that no longer need to be there. And then what do? You build healthier cells. And so that's really the goal of this whole part of it. And so, you know, if send me the most crazy people who have the most crazy things ever. I'd love to see them. I like the challenge. So bring them on in. I'm back actually at the end of May. And I don't know, Beth, do you want me to put in the online booking system in the chat? Because we definitely have.
Yeah, go ahead and put the online booking in the system in the chat. And if you don't know how to pull it out of the chat, you can always call the office, but we need your name and email. If you go into the online booking system, you can book yourself in for May. Edie and Beth Matlock, I want you both to book yourselves in with Anne, like one of the days you're coming in to do Pilates or yoga, and receive a session yourself so you understand what it is. So just I'll give you a quick FYI. Most of you guys know Dawn at our front desk, and this is not going to be a HIPAA thing, because I didn't ask her, but she's not going to care. Dawn popped a popliteal cyst in her right leg, and her right leg was twice the size of the left. Stacy and I both examined her. She had a positive Homan sign, which means when you lift your foot up, it hurts like hell. And it hurt her calf, and it was shiny and swollen. And we both thought she had a clot. We both thought she had a deep vein thrombosis. And so she got scanned, and they didn't really see a clot, but it could have been a clot. So then we got an MRI, and you could see clearly, like, her MRI is like unbelievable, horrible inflammation. She couldn't walk on it. It was so painful. And I called the orthopedic surgeon. I said, listen, I think all you're going to do is do physical therapy, elevation, and non-steroidals. I said, you know, we have this ICR technology. Anne tells me we can get the inflammation out. And she goes, yeah. She goes, this is a 6 to 8 week injury to heal. It's painful. It's painful because you've got to be able to get the inflammation out of the tissue. And so I called Dawn and had her come in, and we treated her 2 days in a row, and she was completely better. Like she would have been out of work for days. Like she would have been out of work because she couldn't walk on her leg. And if Stacy and I, like, we witnessed this ourselves, we saw it. I don't know why she had the Baker cyst, but that level of inflammation and the pain that she had, and to actually see it like right in front of my eyes go down, I was like, all right, Anne, I call she's the frequency shaman, because she knows which frequency you need to put in there. It's creating a couple things. Anne is just a phenomenal diagnostician, and in the true sense of osteopathy. And Susan Apollon, I may tag you for this because, your father's your Rose Ginsburg was Susan's mom, and there's an auditorium at PCOM named after her mother. And we're trying to I want to get Anne an appointment there. I want her to be teaching. We need to get back to where osteopaths actually use osteopathic knowledge about the physical body, because it is so dovetailed with this technology, and it's absolutely beautiful. So Susan, if your ears have been burning for the past few days, it's because I've mentioned your dad, because we're getting connected to a college that wants to have a program to go right through PCOM. Mike Lane is connecting us to the head of the college, because I think this is something that we've got to teach physicians how to heal again, and we've got to give them the tools. And I really think that we're onto something here, ladies. And so the deal is, we want to treat. I don't care if you don't need a healing certificate. This is not a healing certificate program. This is if you're a patient in our practice and you're a breast cancer survivor, you're all in, and we got your back. So there you go.
Beth, can I ask Anne a question? She mentioned like the white blood cell count. So for those of us who are metastatic, like taking the Kisqali, is it possible that this could be a counter? Like every frickin' complete blood panel I do, the numbers for the white and the blood cells are like, it's horrific. I take care of myself and try to keep my immune system strong. But for those of us who have to take the medication, have no choice, could this help with the white blood count, or because you mentioned the immune system and the blood count. So just a question for you.
Yeah, the short answer is yes. The longer answer is we'd have to probably run some tests. And so we would run you through a segment of treatments. This is what we do in Canada. We run you through a segment of treatments, and then you go back and get another blood test, just to see really what's happening in that. And then ideally, we'd probably want to do an entire panel as well to see where the minerals and vitamins are being delivered, and if they are and if they're not.
But Brenda, that's something we would do with your medical oncologist, because we're not treating. This is not a medical treatment. So
I understand that.
I know. I'm just saying that we're not going to be. The royal we. I am your doctor, and I can order it, but I'm not the doctor for some of the people on this call. So
Okay.
that's why I want to make sure everybody knows that if you came in and it's something that I was looking in you to look for a change, I could order those blood tests, but that's not something we would normally do for every person that walks in to receive this wellness technology. Is that
But
clear?
if somebody walked in, like I just saw my rheumatologist and had a complete panel of head to toe of everything. So to Anne's point, you see which minerals, whether it's potassium.
Right.
Can this machine, can the ICR help to address that if there's any irregularities in it?
Yeah, we want to look at ICR as a movement vehicle. So if we get the right card, it can move something into the cell. Okay. And then you create a cell that's more healthy in a way. So if you look at the periodic table, we're basically moving anything in and out of the cell that has a plus on the periodic table. Magnesium, calcium, these kind of things. And if we break down our bodies a little bit more, we're really made of mineral, water, vitamins. I mean, we're more complex than that, but these are the things we want to move to create change in the body and healing. So in Canada, yes, we would use it to target medications. We can use it to move different things in the body for sure. Here, we are only using it as a well-being device to start, for sure. Maybe one day, we'll get it across the line and we'll be able to make some other claims on it. But yeah, so in other countries, we are using it a little bit differently. I think why I opened up that conversation is because I want you all to know the capacity at which it can operate at. But also the well-being cards that we did give to Beth and Stacy are freaking rock star. I don't know. I'd love for some people to speak into their experiences, because some people are like, oh my gosh, I've never been in a meditative state in my life. And then they come out of there and they're just kind of floating on the cloud after they'd come in and had the worst day ever, right? So it'd be nice to get some people's feedback on that as well. And just going to add on to this, we must not discount sleep. Okay, I'm sure everyone on here has had a crappy night's sleep in their life, and you know how you feel the next day. And if you have disrupted sleep, we don't get the healing we want. So probably if I've seen you, I've asked you about sleep because that's something I'm really passionate about, is getting that quality night's sleep, because that's where you really get the healing as well. So just, and that's all well-being, right? But that's all things that we should know how to do, but we might not be doing, right? So these are some cards actually that we have in there. There's one called Deep Rest, and you might be on that one. Some of you are probably on that one. I'm just gonna quick answer. Will there be initial consultation for breast cancer survivors? If you guys just want to book in, so there's a button just for the breast cancer survivors that I made. If you just want to book that one in as your initial, what I'll do is do your intake there, and then we'll treat you at the same time as well. So you guys can just click on that button and rock and roll from there.
The other thing I want to mention is it's incredibly important to drink water, electrolytes, fluids. You've got to stay hydrated. I kind of want everyone to come in there, and before I put them in the mat, say, I have to go to the bathroom. I'm going to pee my pants. Like, that's what I want to hear out of your mouth, is that I got to go to the bathroom before you lay me down on the mat, because that means that you've had enough hydration, you've had enough fluid, that you're going to lay down, because you're going to be parched when you get off the mat, because like we're literally it's a frequency that's bathing your extracellular matrix, that whole part, everything that's supporting your body. And it's when we can get our cells to work better by giving them the nutrients they need. It's like our cells are basically, and they're going, oh, thank you, I needed that magnesium, thank you, I was dying for the calcium. But the only way to get it there is to have enough water in your body to be able to move those molecules. I know Deb McTammany's on here. I know you're not shy, so I want you to put your camera on, because Deb is my nurse anesthetist from my medical missions to Haiti. She's amazing. She was the one that was there to save me when I got stuck by the bad needle. And she loves to do yoga. And she was telling me how you should never complain to me about something, because I'm going to get you on this then. She was telling me how she can't do her regular yoga poses. And so I said, all right, I'm going to be at my sister's house with the mat, so please come over the weekend.
Yes, that's true. I had the pleasure of meeting Anne. Hi, Anne. Yeah, it's just it was a chronic issue I had. I think I had back surgery 5 years ago, and ever since I had back surgery, my hip's been kind of messed up, and it caused me to go into physical therapy for probably about a year and a half. I had very restricted movement. I couldn't do internal and external rotation, and I'm on my feet all day, and I had just terrible, terrible pain. So the pain had subsided, but I was kind of left with just this restricted movement, and it's just something I kind of thought I always had to live with. So yes, I did tell Beth that, and she invited me this weekend. So
my kids would say that I told her to come over.
Yeah, I had no idea what I was walking into. I was asking her all these questions, and she didn't answer me. So she just said, "Show up,
show up hydrated."
Yeah, show up hydrated, and she's absolutely right. When I met Anne literally for like 5 minutes, and then they had to hop on another call. She threw me on the mat. I had no idea what I was getting myself into. And I think I did 2 sessions that day, like back to back. And we did like certain movements to check my mobility before the 2 sessions and after the sessions. And I would say I felt definitely more relaxed. And I think that I had more, maybe I would say about 25% more range of motion just after those 2 sessions. And this is an injury I've had for probably 3 years. So I think it was pretty remarkable. And I even still notice it like, now a few days later, even though I only had those couple of sessions, like when I was sitting cross-legged, which like I really have not been able to do in quite a long time. So yeah, I'm very interested in learning more about this technology because, I said, I don't have breast cancer. I don't have you know, that, you know, what is, you know, the whole reason for this call tonight for you guys for the Healing Consciousness Foundation. But I'm just a very interested observer, and just wanted to share my experience with it.
Deb, but you play a really important role for breast cancer survivors because you are that loving presence that puts them to sleep. For our former partner, Dr. Carruthers and Lena Sizer, Deb is their nurse anesthetist. And so could you imagine having this loving presence being there when you get to go in the operating room and you know that she's going to put you to sleep and wake you up and be there with you and hold that intention for you the whole time? Because she did it. I met her in Haiti in some of the hardest operating room conditions, and we are thick as thieves and connected forever because of it. Stacey Kreischer knows that too.
Yeah, and Stacy came with us one year too.
Yeah, that was a great mission.
Yeah. So yeah, again, thank you, Anne. Such wonderful. I had such a great weekend hanging out with you, and yeah, thanks, Beth, for inviting me.
Well, we're not done yet. We're going to get you a little bit more. So anyway, Michelle Brown, I'm going to volunteer you.
Okay, can you hear me? Okay, good.
Yep.
Yeah, I've been on the mat for 3 sessions so far. And definitely, as you said, very thirsty. Yesterday, I was extremely thirsty afterwards. And I mean, I do drink. I do try and drink half my body weight in, water, but I always put electrolytes. I don't just put water. Because I know you need the trace minerals and all that kind of stuff for your body. So feeling more relaxed. And I have been dealing with some GI issues. So Anne's working on that for me as well, because I just recently found out I have a stomach ulcer. So trying to get the inflammation down there and get my digestive system working better and more regulated that way. So, and that's been very stressful for me. Just because you just never know. It's you just gotta. It's very uncomfortable, and I'm hoping and really feeling really hopeful with this to find out where my cortisol levels are and all that to help with that, because I do my core strength training. I eat very clean. So I want to add that component to get that cellular level, because I know how important that is, and the gut microbiome and all that kind of stuff. So I think this is going to be groundbreaking. So, and I'm looking forward to seeing even more results as I continue on.
And Michelle is such a great leader of the support group. When we did our training back in January, she came to the prevention and she goes, listen, I got to learn about this stuff if I'm going to talk to the girls. So she was all in. So thanks, Michelle.
Yeah, of course.
And Beth Jobson, I swear I saw you. There you are.
Yeah, she's there. I saw her too.
Unmute yourself, because this afternoon I walked in and you were like floating someplace. I think you were on the lunar, the Artemis, because you were floating around the moon. I walked in and Beth looked like, I've not seen her look this chilled. I was like expecting to find a joint like in the table next to her.
Well, I had my 3rd session today, and even the first one, I was so zen driving home that I felt like I was stoned. And then I slept, took a nap. And then last week I had the session. And for the first time in how many years, I'm up all night peeing, because I hydrate, or it could be from the liver and kidneys. I'm not sure. Like every 2 to 3 hours. But last week, I only got up once, and I slept 6 hours straight. And I woke up and felt like a new person. I was running around in the car, like I couldn't believe it. I had so much energy. So that's what happens with sleep. And today's session, when I'm on there, like I do go right out. I'm out. And I say my mantra, which is every little cell is healthy and well, and I am rejuvenating in perfect well-being. And next thing I know, Dr. Beth here comes through the door, and I'm like, what is happening? It's like,
Her,
you're
and her
done.
36 minutes. I'm like, Beth, you're cooked. Get off the burner.
And I'm thinking, no, I don't want to go, and they have more patients. And I was like, okay, I have to go. And I, of course, visit the bathroom. I live in bathrooms. I am a peeing machine. And I just feel like this frequency is helping me shift. Like, you know, uh, when when everything blew up the last time, which was in January, and bad, really bad. And then I had to see this one. I had to get a scan, blah, blah, blah. And then I happened to see Dr. Beth, and she told me about this frequency, and I left there with hope. Like, I wasn't leaving these doctors. Usually, I'm in there making jokes and everything, whatever. I've been on the metastatic journey for 3 years, but I got out of there and I was like, calling my friend. That was such a visit of hope. And I realized, oh, I had lost hope, which I never did before. But just hearing and you know, like whatever, my daughters, now that they know they're involved, it's a blessing and a curse because my daughters are in the oncology. What is the prognosis? And I said, stop right there. I don't do prognosis. I don't do prognosis. And they were like quietly having a fit. But I just realized at some level, I lost hope. And now doing this new treatment and talking to Anne, she is brilliant. She is brilliant. And I love Vancouver Island where she lives. And I leave there and I feel great. I just came home and I feel good. I just like not, physically, yeah, you know, um, it took away pain I was having along my right side last week. That hasn't come back. And now we're really focusing in on the liver, which is lit up like a Christmas tree. Um, and I'm just thinking, tonight, I hope I get the same sleep. And it's a game changer.
Hey, Beth, you know
But
what? When I go to Italy and I'm with Anne and Alberto, I'm having them make me the new card and it's going to be called Hope. I love you for that because I think when you come in there and we have our survivors, we have a thriver coming in for a session. I want him to put together all the frequencies and we're going to call the card Hope and it's going to be named after you. How's that?
oh, I love that. Yes, because if you lose hope, what do you have? And I
I
never
think you've
lost.
been hanging out with Susan Apollon.
Oh, I love Susan. Susan is,
She's right below you on my screen.
oh, wherever you are, Susan, I can't see you, but I love her. But I believe in this. I believe in quantum physics. I believe in the biology of belief with Dr. Bruce Lipton. That came out years ago.
Wait. Guess what, Beth? Guess who's best friends with Bruce Lipton?
Oh,
Dr. Alberto Garoli, the
are
guy
you
that's
kidding?
making your
Really?
frequency cards. Oh, hell
Oh
yeah.
my goodness. I
Yes.
love him. Years
I
ago,
love him too.
I read his book and I do believe in that. And I believe, yeah, I'm doing the chemo and whatever, the hormone
He
blocker,
actually has a
whatever.
new book coming out.
His book's coming out in a few months, right? 2
Yeah, I
months or
think
so.
so. I think so. Yeah, yeah.
He's
Beth,
amazing.
Beth, how about if I try to get an autographed copy for you and me?
Oh,
What do you
I
think?
love it. I love it. I love it. And you know,
Thank you.
it's
You're the
going back,
bomb.
It was
going
great to
back.
see you today, Beth. It was great to see you.
Always
So
great to see you.
anybody else? Listen, here's the thing. This is not a cure-all. This is a healing modality that is helping. It's going to help you bring your body into alignment in homeostasis. That's the same thing that we've done with the Mind Vibe. You know, the vagus nerve stimulation boosts immunity. And we're using frequencies to. We're basically just. I love Alberto used this once. He said we're using frequencies to remind your cells how to communicate with and live in community with the rest of your body, so they're not fighting each other, where they're actually communicating through their electrical signals. And I think I'm excited to learn more about this. Thank God, Stacy Kreischer was put in my path, because she's my Mensa girl, so she's going to be able to understand the parts that I can't, but then I'm going to be able to communicate it, to the masses. So we're going to be we're a really good team here, as we've always been. And just, Stacy's been on the mat, I've been on the mat, Dr. Mazur's been on the mat. We're all mataholics now. It's okay. I'm going to go to Mataholics Anonymous.
Aren't we calling it the magic carpet?
I have a patient that was so debilitated before we put her on. She goes, "I want to go for another magic carpet ride." So now, so all of you have known I've worked with, like, our Tesla technology was called the Marine Battery, because in its initial phase it looked like a battery out of a boat, and then the Vegas technology was a little tiny one, and because that was kind of a little boot, my friend called it the trickle charger. And then I ended up with the non-narcotic pain patch, and Steve called it lick and stick, like you lick it and stick it on you. And now we've got the magic carpet. So, like, I've got my entire bioelectric, bioelectric arsenal. I also did another talk for Mind Medicine Australia, you guys, if you're interested. It will be, I'm getting it edited. It should be up next week. And it was called the Mental Health Code Card, where I talk about all the different interventions we have for mental health and well-being. And I'm just excited for this next chapter. I've committed to my beautiful partners that I will continue to work here part-time for 2 years, because being here, when I come in to work for the hospital, I'll do my job that I have to do for survivorship of the hospital, but then I'm going to spend probably a week really focusing on ICR, so that I can keep everybody moving forward with protocols. And Anne has taught me something really valuable, is like, this is a layered process. It's not like some people can do like one and done. And just, Dr. Caddy's all on board with this. For anyone who has her an oncologist, you can speak freely to her. And she did talk at tumor board this morning, and she said she never got her stinger back in her neck. So she was pretty happy about that.
Yeah.
So, and she's very interested in being part of the research with us. She sees the total benefit. She's like, I'm all in, ladies. Like, sign me up. We went to dinner. And I did put her on the magic carpet before we went to dinner. That might have been a really good move, but it's all good. We're just moving and grooving. I'm really excited, because I don't even know what the total possibilities are, but I think there's a lot that we don't even know about. So
I agree. I think, obviously we can't speak to anybody individually, but it's been pretty amazing, the results that people are experiencing with this wellness device. So, and I think there's, like Ann said, there's tons of potential to use it for all kinds of things. So, a lot of stuff to look into.
Yeah, it's really unlimited when you think about it, because we have to create the frequency that's going to speak to what you're expressing, and over time, as we collect more data, we'll be able to even improve ourselves as well. So I guess I'm just really grateful that when you all come in, how transparent you are with me, because it makes my job a heck of a lot easier to really figure out maybe what layer you're healing on, so to speak, that how it goes in my mind. And so thank you so much for your openness, and thank you for welcoming me into the clinic, because here I pop up, I'm this random person, and everyone's just been so wonderful. So I just wanted to say thanks to that, because I've had a great time being in there, and I'll be back on May 20th, just so you know.
Any questions before we wrap up? And I just seen I was going to post all this stuff on the website, on my personal website, and on the foundation. But I wanted to have that now that we were doing this. I wanted to have this little meeting first so we can understand it, and then you can take the deep dive. You can we'll post links. Okay, this is the royal we. That means Christina. We're going to post links to the papers if you want the science behind it. Because if your family members say, well, what is this magic carpet you're going to lie on? You can show them that there's actually clinical data about it, and
Right.
it's going to be fun.
Are
This
you
is
going
one
to
of those
post it on
times.
the HCF
HCF,
website
yeah,
too? Okay.
yeah, it'll be on the HF. But this is one of those times in life when I say, like, we're at Six Flags, and I want you to put on your safety belt, bring the harness over your shoulders, keep your arms and fingers inside the tram car at all times, and be prepared for the ride of your life, because we're there. We're there.
We'll take the magic carpet ride.
There you go.
I've got a
Amen.
question. I got a
Yeah.
question. Being the
Who's-
energy
who's-
worker person, it raises the energetic frequency of whatever you're working on. Is that how it works? Or am I
When
off
you
somewhere?
say energetic, raising the energetic frequency, what does that look like to you exactly? Just get some clarity.
Well, energetic frequency of the whole body, the energetic body. I have something where I practice where I raise my frequency higher
Mhm.
so that I don't know how else to explain it. I'm in a total different state of mind where it's more positive.
Yeah.
Does that ring a bell?
Yeah, it totally resonates. I guess I was just trying to think how I can connect that in. So the answer is yes. We've been developing some really neat cards actually. There's cards that change brainwave state. And I think that's in a way what you're talking about because when when our frontal lobe is really strong, we get quite logistical, practical, logistical. I can be that person sometimes. But then when I put myself maybe more into a delta state or a low alpha state, meaning the brain waves are kind of slower and longer and life's just kind of cruisy and I'm feeling pretty good and everything's in flow state, that would mean that we change the brainwave state. And I would go into brainwaves on that, but I also want to say that some of the cards pump in micro Teslas, and those are very low level frequencies. So for the scientific people on here reading the papers, you're going to see micro Teslas on there, meaning that when you're on the mat, the frequency is consistent but low in the body, so it's repetition. You might hear that, and it's a repetition basically retraining the body in your 36-minute time that you're on the mat. Some of you are on for a little bit longer, but that's really what it's doing. So there's two kind of levels there that I'd like to approach around frequency. Did that answer your question, Penny?
It did.
Okay.
And I'm sure there's different frequencies for the cells, for the blood, for different parts of the body, right?
Yes. Correct. Yeah. And you're talking maybe more on a spiritual front, is that right?
Basically, yeah.
Yeah, so I mean, look, I don't know if anyone wants me to go in the deep dive, but I'm totally happy to do it. Every soul has encompasses a body, right? And if you're working on a soul level, let's say, maybe outside of your body a little bit with your soul and how you connect into your body. So there's cards that we've created to help people connect into who they really are. I mean, every individual on this call has a unique individual purpose on this planet and we must realize that. And then the more you go and live that and align with that, the more your life feels great, right? And we've probably all been in times too where life feels a little bit heavy and dense, and heavy life creates heavy and dense cells, right? We know that. So I think maybe what you're talking about is getting yourself maybe more into alignment with who you really are. And we can take people on processes. There are people using the mat actually with particular cards, and then they put in, their coaching methods and things like that while they're on the mat to help expand into maybe more the soul level, if that's makes sense to you. Yeah.
Thank you.
You're welcome.
Anybody else have questions? Susan Apollon, you need to come in. Did she pop? There you are, Susan. This is one of those heal the healer technologies that I when the very first time I got on the mat, I had just come back from facilitating in Mexico. And it was awesome. And they plugged me in for two recharge sessions. I slept like a baby, and I felt like I was getting a little bit of a cold, and it was gone immediately. And I was like, it just recharged my batteries. Like that's what, it was like, and it was just absolutely beautiful. And then I blew the fuse, but besides that, it was a wonderful first day.
And we had to do surgery on her mat, which I saw Dr. Beth in action, by the way. So she's good.
I could change a fuse. They were pretty impressed.
We were impressed.
You ought to see me in the operating room.
Recharge card's really interesting because it lowers oxidative stress. So as we age, even like, white hairs, gray hairs, these kind of things are oxidative stress related. So as we lower it, we tend to slower the aging process. It's interesting. I did a little test run on nurses in my local area who were working shift work. And we just did that one card only, which has a lot on it. It's actually kind of the golden card if we were to use one, but it has an anti-inflammatory, so it reduces inflammation, it reduces oxidative stress, it aids digestion. Probably a few of you on here have been on it. And with the nurses who were working shift work, we were able to help, regulate their sleep a little bit more and actually get them into, a proper day of living. So they would come and when they were switching shifts over, and we would treat them, and then off they go. And there's some local firefighters in Canada using it as well on shift work. So on the West Coast, we get these crazy forest fires, and they work long, long shifts. We pop them on recharge. They're able to actually regenerate pretty quickly, and off they go again. I'm not saying that it's this card that you can use and then, be superwoman forever, but it's nice to just give you a little boost for those people who need to go back and get to work. It's been really beneficial. So it's a practical way people are using it.
Ladies, we're gonna you can reach out to the office. You can reach out to me. I'm going to end the evening by showing you one of the most important things in my life right here. Hold on.
Margo.
Well, it is pretty. She is pretty special. She is going to turn 1 in May, and she's going to have a birthday party. And this is her glam shot from my house in Sedona when we were out there for spring break. So she's just like the best little bundle ever. And Susan Apollon, we got to get you back here to see her, because I got to bring her to you, because she's the cutest thing ever. And my beautiful daughter-in-law turned 30 today, so we had a fabulous celebration. And thank you all for showing up tonight. I'm really excited about this, as you can tell. We're hoping to just help a lot of people rest, digest, relax, and let your body do its own healing, because that's really what all we're doing is finding which microtesla frequency your body is craving, and then bathing your body in it through the mat. So let's go. Christina, you need to get on with Anne. Let her do your intake, and then you're going to see Joe. You hear me, young lady? Good.
I'm ready.
All right, good. Love you guys. Everybody have a great night. And ciao, Bella.
Have a safe trip.
Ciao.
Enjoy.
Thank you.
Bye, everybody.
Bye-bye.